No, I don't understand. Hello. So sorry, I don't understand what's going on with Instagram. They keep kicking me out of the live, but hopefully, I hope that it stabilizes as we go on. So, like we said before, assisted reproductive technology, a lot of you are aware of IVF, and I'm sure a lot of you think that IVF is only the only procedure under assisted reproductive technology. No, IVF is just one of those procedures of assisted reproductive technology, and as the name goes, assisted reproductive. So we are basically trying to help, to help with those difficulties that have to do with achieving pregnancy. So the technology in itself, everything, or we're talking about every procedure or fertility treatments that have to do with helping people achieve conception. And when you're talking about the assisted reproductive technology, we are talking about techniques that have to do with manipulating the eggs, the sperm, and even the embryo for the woman to achieve a successful pregnancy. But like a lot of us, this pregnancy of a thing, a lot of couples go in thinking it's magic. It doesn't work that way. And when conception or pregnancy doesn't occur naturally, and that's where couples start to seek, help. How can we, overcome this hurdle of looking for pregnancy? And one thing you must, we're not going to deal with the myth involved with all these IVFs and all of those kind of things. We're not going to talk about that today. But I want you guys, when couples come to the hospital, they have a whole lot of expectations from the doctor, from the procedure, and all of that. And if those expectations are not met, a lot of couples, their aspirations, their dreams are dashed. And then some of them still just decide, okay, you know what, we're not doing again. While others still keep up the faith and just keep on moving and hope that, this one will work. A lot of couples that go ahead and seek assistance in achieving pregnancy are the ones that some doctors don't tell you the whole truth. And I don't think it's fair on the part of the patients, because in as much as we are on the side of trying to help you get pregnant, we must also be realistic about helping you achieve those goals, and I mean, it's not enough to say, okay, if you do IVF, automatically you will get pregnant. No, it doesn't work that way. So having this conversation with you is to be able to clear all those unrealistic expectations. But at the end of the day, what we are praying for is we are both on the same side. We are hoping to achieve pregnancy at the end of the day. So the first form of truth a lot of people may not actually emphasize on, a lot of doctors don't emphasize on, is first the whole idea of conception. And when I talk about conception, I'm talking about the production of a baby, like when bring a sperm and an egg together and it produces a fetus, like something comes out of it. The whole idea of that conception or the conceptual process is a very, I consider it as a fragile miracle, in as much as we want to believe that, okay, once you get married, as soon as you get married, it's automatic. No, it's not. I remember in the previous posts and in previous discussions we've had, I keep saying it, sometimes or most of the times, this thing called conception or having or fertilization is more spiritual than than physical, in as much as we doctors have been put there to help people get pregnant. It's still, we don't have everything. We are not the ones that hold or have the final say as to whether the procedure is going to work. So that, I feel like that's the first thing a doctor should let his client know. What are your expectations? Now you've realized that, okay, you got pregnant, 2 months down the line, pregnancy is not coming, 3 months, 4 months, 5 months. As much as 1 year to many more years, pregnancy is not coming naturally like everybody else. What am I supposed to do? What are your expectations? I want to know, what do you expect? How huge are your expectations? And I also need to let you know the emphasis on the fact that conception is a fragile it can make or mar a relationship. When you see that, I mean, everybody expects that once you get married, you don't want to see that your monthly visitor. Yeah, nobody wants to see it. But if it comes, some couples handle it well, other couples don't. More so on the woman who is seeing the blood. She don't want to see that blood, and if she constantly sees it and expects that she should get pregnant, despite all the things they've tried. So it's why I consider it a fragile process. It can make or mar a relationship in a marriage or the relationship between couples. Now, secondly, I want to emphasize that medications also play a role in revving up these techniques. So don't think that, okay, we say IVF, so definitely we'll collect the sperm, we'll collect the egg, and then we'll just chuck it in. No, it doesn't work that way. See, remember I told you that these techniques involve you manipulating eggs, manipulating sperm, and even the embryos. One thing I must let you know is that at every stage of a woman's cycle, because we have to look at her cycle, sometimes we are the ones that even do the cycle ourselves. No matter the stage of her cycle, we're the ones that start it ourselves. We will give her drugs. We will give her drugs to refresh her cycle. We will still give her drugs to produce a lot of follicles that contain those eggs that we are going to collect. And we'll still give her drugs to prime the womb that will carry the pregnancy. We will even give her drugs that will help to sustain that pregnancy. So you can see that IVF it's not just IVF on its own. Even the process involves medications. So it's not, it doesn't just come just like that. You have to understand and keep an open mind that at every point in time, drugs will be involved. The drugs actually hasten the process. Now, another third thing I think a lot of doctors may not emphasize in this process of looking for assisted reproductive processes, the procedure that they might have highlighted are not completely 100% or perfect. And I say this because assisted reproductive technology is assisted. It is man-made. Anything that involves God, anything that comes naturally is 100%. So don't go to a hospital that will tell you, oh, this IVF you want to do, or other procedures or other forms of assisted reproductive technology, that's it's 100%. No, anything that has to do with man can never be perfect. Everything that involves God is perfect. So why I say this is that for a lot of you who are seeking to use or go through this route to get a pregnancy or get pregnant or get a baby, should understand that the process can never be perfect. Every human being is different. Every woman is different. How her body makeup is different. Her energy level, because I believe in a lot of energy, is different. Your level of faith is also different. So it involves a whole lot of process. This IVF of a thing, it involves a lot of process. So definitely keep it in mind that because it involves man, it cannot be perfect. When I say man, we're not looking at only the side of the doctor. We're also looking at the people coming to seek such, help. Now, why I say this, there's some doctors that are very positive, but unfortunately, a lot of patients or clients are very negative in their thoughts. Their faith level is as low as, and so I wonder yourself, why did you even bother coming if you know that you don't even have faith in what God can do? Coupled using us to help you. Do you understand? So understand that when you're coming to the hospital, in as much as we are saying we're going to assist you, it does not make the procedure perfect. Do not let any doctor fool you and tell you, oh, it's a perfect procedure, it's 100%. Nothing that comes that is not totally God involved is 100%. Understand that. Okay? Just keep an open mind that God has the final say in making sure that the process is perfect. Now, the fourth thing I want to highlight is the fact that IVF or any other forms of assisted reproductive technology is time consuming, and it can be very invasive. A lot of people along the line cannot withstand the stress that comes. I won't call it stress. Like I said, if you come with an open mind, it will be seamless for you. But if you want magic does not occur when it comes to IVF and other procedures. No, you need to be patient. And patience is a virtue that a lot of clients lack. Now, if you want this thing to be seamless, you need to calm down and work with your doctors to ensure that every stage of getting you to that point of getting pregnant is achievable. And always remember that it is within your right to ask questions. You have to ask questions. You asking us questions makes it even much easier, and the process actually easier, or the time frame easier and bearable. Okay, now when I say time consumed, yeah, you may have a fixed mind as to when you are supposed to get pregnant. A lot of people just say, oh, within this period I want to get pregnant, blah, blah, blah. No, it doesn't work that way. It can be time consuming because every woman has different causes or different things that may be preventing them from achieving pregnancy so fast. So depending, for example, you cannot compare someone who needs surgery first off to be able to access her womb. You can't compare that person to someone who literally has no other issues. Her hormone has been balanced, and just to withdraw her eggs and fertilize and all of that. You can see that the person who needs surgery will take more time. And after surgery has been done to open up the area or remove the fibroid or remove anything that will prevent the pregnancy from occurring, you still need time to heal. And with time to heal, there are other small tests that you may need to do. To be honest with you, it is not for the faint-hearted, and that's the honest truth, but it is worth the trial. It's worth the wait. It's worth the time. And I can only assure you that in as much as what makes it invasive is obviously the procedure. Sometimes the procedures, you need a form of procedure to get that to happen. Sometimes IVF might not be the thing that they need. There's a procedure called ICSI too, So there are so many procedures that you may need to just go in and help them to even put it there, even getting into the fallopian tube and all of that. So it can be time consuming and of course invasive, And then the fifth thing I actually want to mention that has to do with the assisted reproductive technology is the side effects. Yes, sadly, some of them, not totally, some of them do have side effects, and the side effects can come from any part of or any stage of helping you get pregnant. Like I said before, sometimes surgery, there may be complications of surgery, and the complications can come from the surgery itself, it can come from the drugs there, it can come from the reaction to anesthesia. Everybody is literally different. So don't let any doctor fool you and tell you that, okay, IVF doesn't have its complications. IVF has its, I won't call it side effects, but I will call it risks. It comes with some risks. There's sometimes before you can even say you want to get eggs, there's something what they call ovulation stimulation. There's a stage of the assisted reproductive technology that you need to stimulate the ovaries to produce a lot of follicles that carry those eggs. Okay, so we need to prime them, and in the process of priming, so women tend to overstimulate. They get overstimulated, produce a lot of eggs that cause a lot of issues, and before those the edema comes down, that's the swelling, the pain, and everything reduces. I'm not saying it's the percentage of people who suffer this are actually close to nothing, but it's good for people who come in for procedures, for a doctor to highlight all forms of risks that are involved with the process. Okay, we have also risk of multiple gestation. And what do I mean by multiple gestation? Sometimes a woman or couple might just want one, but the eggs end up splitting into 2, 3. On the flip side, it's a good thing for someone who has been looking for pregnancy for a very long time. Do you understand? But on the other side, if you've had previous children and just want one more, it might end up having 3, 4, and that's one of the side effects of assisted reproduction. Now, you can also have people reacting to medications, like I highlighted. You can have allergic reactions. Some people react to allergic. We're not saying, see, it's always good to just put everything on the table, and then you make that decision to say, okay, it is not my portion, or now I know, I will be alert to see if there are any. Of course, no doctor is going to put you at any risk and tell you, oh, the pros are actually much more than the cons. But also important for everybody who decides to go through the route of assisted reproductive technology to have a great knowledge that there are side effects or risk factors involved. And of course, we have situations where, we stimulate the ovaries with cotton follicles. Voila, no egg. You get plenty follicles that look big. That's the flip side a lot of doctors will not tell you. And that's why sometimes the IVF, so to speak, fails, and you may need to repeat the cycle. And then I understand that the process can be, can be very trying, but that's the honest truth. And that's why I'm trying to tell you that a lot of doctors might not tell you this, but in the process itself can be so trying. I said you will stimulate eggs, and all of a sudden the follicles are plenty, they all look ripe. You collect the follicles, now time to implant. No egg inside. It's just an empty shell, and those cases you find in women who decide to want to use their eggs at an older age. Like I told you before, as you get older, fertility rate drops. Your ability to actually get pregnant drops. So we're not saying that there's still not a percentage of women that don't use their eggs. They use their eggs, but we're telling you now that the older you get, the chances of you using your eggs are actually small. So a lot of people don't want to do that. And like I said before, if you decide to go ahead and use your eggs, there's some cases where you stimulate those ovaries and then the follicles are large, but there's nothing inside. There's no egg. And even if there's egg, the quality is really next to nothing. And there's some cases where we get the eggs, but unfortunately there's no fertilization. For some funny reason, the sperm and the eggs don't fertilize. And I'm just highlighting you all the, and you see, the earlier you have a good knowledge of what goes on during this process, the better for you. And that's why I feel like everybody who needs this process needs to bring their A game. And what do I mean by A game? Come with your fully loaded with prayer that God will, now that I have started this process, it must complete it. Let this process work. I don't want a case of empty, no egg. I don't want a case of no implantation, because even when sometimes you get to fertilize the sperm and the egg, the baby gone will not fertilize. I'm sure you've heard of cases where maybe the woman has a successful IVF, like we've managed to actually transfer the embryo, but expect that the doctor will tell the person, okay, come like in 2 weeks, we'll check if the pregnancy result is positive. And unfortunately, during that process, she starts to experience loss, like she starts bleeding again and all of that. One thing you must know, we do not have a complete say in how those processes. Remember that we are actually, assisting in the natural process of things. At the end of the day, God has the final say. So I want you people to be well educated on this, because these are truths a lot of doctors might not want to scare you so that you will still stick with them. But for me, I feel like informing you, it will be nice for you to be well informed so that your expectations are not unrealistic. And so anything that happens, you know that, okay, it happened and occurred naturally. No doctor would deliberately want to collect your money, help you through that long process, and then decide that you will not get pregnant. No, you need to remove that mindset. That is why I kept telling you that this assisted reproduction, all this IVF, everything, all of them cannot be 100%. But in most cases, our prayer is that it should be perfect and it should go through. So like I said before, sometimes there will be no egg. Sometimes it might not implant. Sometimes it might not even, it will not infertilize, it will not implant. And then sometimes the embryos, even when it finally implants, it's just crazy, right? Even when the embryo finally implants, like sits in the womb, it may not progress. So even if the woman tests positive in her pregnancy and you tell her, okay, come, let's check if you're pregnant. Yeah, the pregnancy is positive. It looks like we can see a fetus and everything, but the baby is not growing. So come 1 month, 2 months, 3 months, the baby is still how it is. It has not moved. Definitely, it's not viable. And at that point in time, it's time to take that baby off, because it's not, and then maybe there's no heart, anything. So definitely we'll have to remove it. So, but that doesn't mean that you should trample on your faith or what you want to do. No, you keep it moving. Remember, I told you, anything is assisted now. It's not like it's a completely natural order of things. We are just assisting. You know, we cannot take the place of God. So I keep telling people, bring your A game. Make sure your faith can move mountains. Make sure that when you come in positive energy, so that your body is radiating with positive energy. Whatever that doctor is going to, or the doctor you meet, must have positive energy to help you achieve that aim. And that I pray for that for everybody. Now, moving on to the next thing, the next truth that a lot of people may not emphasize on, that in as much as we are shouting assisted reproductive technology, you need to understand that there are options also that people choose to explore other than this technology. Yes, there are other options. So even if you want to use your egg, even if you want to do whatever it is, they have surrogacy agencies that assist in getting people to use other people to help you get your pregnancy. It doesn't mean that the baby is not your own. So depending on the situation. So what if you're an elderly woman, maybe you're in your 50s, you still want to have that feeling of wanting to get pregnancy. You don't necessarily have to be the one. You can go through the route of surrogacy, donor eggs, donor sperms. Nobody needs to know. Nobody needs to know. It's actually not, I mean, it's not like you're going to accept you're going to do it and you're going to have a village meeting. Let me tell all my village people, I'm going to use another. No, it's your baby. I think most women, especially African, Nigerian women, want to have that feeling. They want to know what it feels like to go through that process of pregnancy and eventual delivery. Yeah. So whichever egg, whichever sperm you want to use, or even if you don't want to carry, there are some people that do not do these things because they're looking for pregnancy. Some people go through the route of assisted reproductive technology for maybe sex selection. Maybe they've had like 10 girls and they want one boy, and that one boy will be the one that will save their family. No, there are different reasons why people use these things. So there are many options. There are many options you can explore apart from just the IVF and all of that. You can also do the donor thing. You can also do the surrogacy thing. Okay. Another thing we need to talk about is don't let anybody fool you. IVF or any other form of assisted reproductive technology is expensive. Or more, you don't want to know, it's expensive. So it just baffles me how some clients think that, okay, the money doesn't come to the doctor. Trust me, it's a whole lot of process. Do you know that from the drugs alone are so expensive? I don't know if maybe some doctors don't sit down to let you know. It involves a whole lot of team to make sure that thing works, because you know we are trying to help you do something as naturally as possible. So the extreme care that comes with, you know, kikelomoing the baby, like getting even the sperm, getting the egg, getting it to be a baby, getting it into your, oh my gosh, it involves a lot of team. So not only the doctor of course will do his own thing. We have the embryologist, we have the anesthetist. Okay, we have people that work in the team in the theater, right? So the point I'm trying to make you understand is that it's a whole lot of, it's expensive. And if you are unfortunately a candidate for maybe surgery before the process starts, for example doing a laparoscopy or surgery, other forms of surgery, definitely it even increases the pay. And not only that, if we're not going to use your egg or use your partner's sperm, it further even increases the pay, because you're going to have to look for the surrogacy, or you're going to look for a donor company or an agency that provides donor eggs, donor sperm. You're going to pay them. We're going to preserve. Even preservation is expensive, because we don't preserve them anyhow. There are special gases that are used to preserve the situation. There's some people that we even decide, okay, I have so many babies, but I just want one at a time. I want to space them. So we have to store them. Haven't you heard of, stored or frozen embryos that people keep for 12 years, 15 years? Yes, no worry. Like I said before, we're going to deal with myths much later, but this is basically telling you the truth of the whole idea. Drugs alone expensive, and everybody needs to get paid. Everybody needs to get paid to help you achieve that process. And trust me, it doesn't come cheap. Let's not talk about having to do the process of sex selection. those samples leave the country just to ensure that you get what you want. They leave the country and come back to you, and you are, because at the end of the day, what are you looking at? You have to look at the value, the eventual result that you're aspiring to. So if you focus your mind too much on money, nobody will be able to achieve their aim. So you need to ask yourself, what do I want? Am I going to focus on how expensive it is, or am I looking at the value of what I'm going to pay for? So if at the end of the day what you're looking for is to get bouncing healthy babies, come on, everybody knows it's not an easy thing, but you have to give kudos to people at every point in the process that help to make that happen. Okay, then moving on, we also want to talk about lifestyle. In as much as we say, okay, we want to help you, basically using all the process, the techniques, the technology, come on, you still need to help yourself. And what do I mean? Your lifestyle can make or mar the process of IVF or any other procedure. So what do I mean? You need to keep your body healthy. Like I said before, even if the doctor helps you get a healthy sperm, get a healthy egg, gets a healthy baby, you need to be healthy enough to keep that pregnancy. What do I mean? Make sure you keep your weight at a barest minimum, like a healthy weight. You cannot be obese and then implant. In most cases, it might not even work. A lot of things working against you. You cannot be in the middle of stress. Remember that there are hormones that also make pregnancy happen. Okay, so even if we help you to achieve and fertilize those eggs, and we finally get a fetus or an embryo, come on now, you still you need to play. You have a major role to play. The kind of food you eat, because sometimes the food, you need nutrients to also. You need nutrients. You need special nutrients that can keep the pregnancy, like folic acid. I'm sure all of you already know that there's no pregnant woman they don't give folic acid. But before then, your body needs to be ready to accept that pregnancy. So for people who are in the special category that we try to help pregnant, we always tell you, please come healthy, or try to even live a healthy lifestyle. Now, it involves making sure your body does not experience stress in any format. And I mean stress, because stress produces negative chemicals that don't allow pregnancy to sit. So please ensure that you have a form of stress management. Manage any form of stress. If you know it's your family that is stressing you, find out what it is that they're stressing you about and start to deal with those problems one by one. If it's your work that is giving you headache, my dear, work, don't worry. Maybe you want baby. You can either have two choices. Either you leave the work and then revisit it later, or something else. And then ensure that you're eating well. Ensure you're exercising. It's very important to keep that body moving. Trust me, anybody who has been in an unhealthy state and has not been exercising, tell them to tell you how it feels when you're exercising. Exercise keeps the blood flowing and keeps everywhere open. So it's important. I'm not asking you to go and do the kind of exercise that will make you look like muscle man or Miss Nigeria. No, I'm asking you that you keep the exercise in a situation where your blood is constantly moving and is looking healthy. So at this point, I don't want to talk so much. I want you guys, if you know you have questions that you want to ask at this point, please, I'm very open to questions. I don't want to be the one talking all the time. So if you have any questions, because that's pretty much all of it. So all this truth I've told you is not to scare you, but basically to keep your expectations of any form of assisted reproductive technology healthy and realistic. Okay, it's very important that we educate anybody that wants to start. First of all, I will want to know your level of expectation. I mean, at the end of the day, me and you, we want positive results, but we also need to be realistic and look at other things. You cannot use A to measure B. No, everybody is different. Everybody's destiny, like people will say, is different. Okay, you cannot use A's body and A's problem to measure your own problem. No, face yours and let's deal with it as it comes. Okay, so this topic someone's asking a question. So can we call? Yes, you definitely. I had my myomectomy. Oh really? I hope you had a good experience. You can call in. I'll definitely want to accept. Yeah, I'll definitely want to accept. I don't know how that works, but if you call in, definitely I'll pick it. Definitely. Oh, so Jumi, did you have a good experience when you had the myomectomy? I'd like to know that. I don't know if you can hear me, but I hope you did. And if you want to call in, yes, you can call in. I don't know how that works. Let me see if that works. Okay. Maybe when you ask or request to join, I'll be able to. Okay. Any more questions? Jimmy, I'm still waiting for your answer. I hope you had a good experience. And since it was 2 years ago, definitely I believe you did have a good experience. Okay. I'm waiting, guys. Come on, hit me with the questions. I'm all here for you. I'm all here for you. Hit me with the questions. I'm not leaving until but then again, I will not want to hold you. If you can always send me a message anyway. You can send me a personal DM. I'll definitely get back to you. But I hope this conversation, and of course, if you missed the beginning, you can always watch it on the now subsequent posts. And again, lest I forget, if you guys want to also, you can also follow our page. If you know this is your first time here, please follow Clearview Hospital, of course, on Instagram, and follow the sister handle, Ask the Family Physician. Go follow, let me see, follow, let me pin it, follow, ask, let me put it, so that a lot of people are asking me, Ask the Family Physician. Yes. So you can follow us from, so kindly follow. Oh, Jimmy, I've accepted your request to go on live. I've accepted your request. I hope it goes. Okay. I hope it goes. I don't know why it's not going. Oh, thank you so much. So I believe, thank you. That was a very positive review. You guys, come on. Give us a review if you like it. Yeah, because it's very important. You know, I love you guys and I care for you so much, and I like fairness and I like justice. I mean, it's not by your might. I mean, nobody prays for people to be in situations, but we want that when we want to give you that service, we are giving you service with all our might, and we want to do it to the best of our knowledge and experience, and of course, God willing, everything that comes with it. I don't know, Jimmy, this thing is not, I've accepted already. I've accepted it. Hello,
good evening. Good evening.
For coming on board.
Yeah,
So you
I've
said
been to your facility like 3 times after my myomectomy. I still spoke to Dr. Kunle. Was
yes.
Tuesday. Okay, so I think what happened in my own case is the fact that my tubes are blocked. I don't know.
Okay.
And then they saw some adhesion. I thought that what I needed was an HSG after the surgery. But then I did an HSG, and then they found out that my tubes, I had a bilateral hydrosalpinx.
Yes.
I don't know. What do you think about sapingostomy? Doctor was discouraging me, but really, this process of IVF, it scares me. The fact that you're going to pay a lot of money, go through a lot of hormonal stimulation, and then you're not even sure it's 100%. Like,
yes.
I've been having this drawback. Like, in fact, there was one day I came to his office. I was like, Doctor, let me pay a deposit so that I will come back. He was just looking at me like, you're not serious. Anytime you want to come back, I'm waiting for you. But totally, then you know how the mind works. You really want to do it, but you hear people who have done it twice, 3 times, and you also hear people who have done it once. So it's just,
see, like I said
I
before,
know that you people are professional and that you are good at what you do. What you do. My surgery was seamless. I healed very fast.
You should not come and done it immediately, but you can still do it because once you've done the surgery.
And meanwhile, doctor told me, he mentioned it to me. He said he's giving me 6 months after. But
Yeah.
then I wasn't dating seriously. So
Okay.
eventually, like 1 or 2 years after, when I got into a relationship and okay, I was not ready, and then it's been a struggle. And that was what prompted me to going for the HSG. And we find out that there is a bilateral hydrocele things, or what's that called? And then I now need an IVF. And I've
Guess
just
what?
been my mind is
Can I
just so I
something?
won't lie to you, I'll be that's like anytime I see you come on live, the network is bad.
No, don't worry.
Anytime I see you come on live, I just click because I want to listen. I want to prepare my mind because I mean, one is
Okay.
not getting any younger. I'll be 36 in February, and
Don't worry, it's gonna happen. But let me shock you. Let me tell you something, and that's why I believe I feel like I need to do this video. Do not
okay.
use else's own to measure your own. And I always tell people, like, I don't know how it works, but for me, this process called IVF and all works, all the things you can imagine, is a very spiritual process. Do you understand? I'm not going to, even as much as I hear all the myths and all the funny things I hear around me, no, I'm going to block all that noise. This is something you know that when you do, it's going to work. And you tell God, it has to be fine now. Do you understand? You have to unite. And I always say that for me, if you have
But
a
what's
love,
the entire process? Because for someone like me, I am
Mhm,
hypertensive and it's quite a bad case.
mhm,
I'm trying to work on my blood pressure. At the same
yeah.
time, I know that next year for me is going to be a very busy year. I know that I'm not sure my body is ready for that process.
When you say busy, what do you mean?
Busy because I have a lot of projects coming up. I'm into
Did
building and all that.
you watch my last video? Did you watch my
I
last
did.
my last
I did.
session?
No,
Ha!
I didn't.
It is a lot of women are in your shoes. They tend to put a lot of important things first. Remember that you have your biological clock. I talk about biological clock. So for
Yeah.
me, projects will not run away. You have to decide what is important to you.
For
And
money, we're going to take care of the child with money. But
no,
what I think I would come to do is I will
yeah,
come and do the process and then freeze the embryo. How
okay,
about that?
you can do that. But how about okay? You want to finish your project first, and
Finish the project, then get my body to be minimally stressed because right now, like now, I do in
okay,
and out of Lagos. I'm only in
okay,
Lagos for the weekends, like from
okay.
Thursday to Sunday.
I,
Monday
I
to
think
I'm always on the
like
road.
the idea that you have. Come in, let's freeze your eggs, or we can freeze the
So we can
embryos.
freeze the embryo because freezing of the eggs is not. So
Fine, even if you are.
I'll come in
Yeah,
maybe early next year, like January is going to be my my project for January before I turn 36. Let me know that okay, I have an
yeah,
embryo breathing somewhere. Then I'll go and prepare my body, prepare
I totally
myself
agree.
emotionally, physically, save enough, and like okay, let's
Oh,
do
let me
this.
let
No
you know
problem.
that we are partnering with Access Bank. We have a special package for people who want to actually do assisted reproductive technology. Access
Okay.
Bank is to provide funds for that, in which you'll be paying small, 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 small. So I think you may need to revisit that. So you
Okay,
don't
I
need to be
will. But how much, what's
planning.
the cost? Okay, I can always ask doctor what the cost is. I'll come into the office maybe next week. Then
Okay.
probably won't do a deposit because I really need to be pushed to do it because
Everything
we just keep
I want
postponing,
to
and
assure
then
you.
eventually
I want to assure you it'll be fine. Just come
no problem.
positive. Be positive in your thoughts. Block out all the noise and don't let your brain go on overdrive. Okay? Don't let it be on overdrive. When your brain goes on overdrive, even the things that have not happened are yet to happen. It will scare you and
Yes,
prevent you achieving
yes,
that. Don't let that happen to you. Okay? It's
yes.
not
You're
as
right.
and like I said before, end of the day, God has the final say. And nobody, no doctor will watch you suffer. We are with you all this, every phase, every step
I
of
know,
the way.
I know, I know, I know,
We are with
I know.
you.
I know
And
your
of course, God,
aftercare process is actually fantastic. Thank you very much, doctor. Thank you so much. So see you next week. By
by
God's
God's
grace.
grace. All
Thank
right. Thank
you.
you so much for coming. Thank you.
You're
All right.
welcome. Bye.
You can put it up from your side, I think. Okay. So, I don't think I know how to do this. Let me see. How does it go? Okay, anyway, at this point, I'm going to have to close. And if you guys have any personal message, please send me a DM and I'll be glad to answer. Okay? Okay? So thank you, everyone. Thank you so much for those of you who took time out to be part of this conversation. Please stay tuned next week, Thursday. We promise to, bring a topic that will also help to address all these issues concerning fertility. Thank you once again, and please stay tuned next week. And God bless.